Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Gas. GI. Introduction. Everyone has gas. Most people pass gas 13 to 21 times a day. Gas in the digestive tract comes from two sources: air that you swallow and the breakdown of undigested food by bacteria in the large intestine. There are ways to reduce the amount of gas you have. Medicines can also help reduce pain and bloating caused by gas. This program explains gas. It talks about what gas is and what causes it. It also covers the treatment and prevention of gas. The digestive tract. The digestive system helps the body digest and absorb the food we eat. This section explains the anatomy of the digestive system. It will help you understand gas. Swallowed food goes through the esophagus and enters the stomach. In the stomach, the food is partially digested. Partially digested food goes from the stomach to the small intestines. More nutrients are further digested and absorbed. Fibers and digested food finally reach the colon. The colon absorbs water. It is a storage area for stool. Gas is air in the digestive tract. Gas can leave the body through the mouth. Passing gas through the mouth is called belching or burping. Gas can also leave the body if it is passed through the anus. Passing gas through the anus is called flatulence. Most of the time, gas does not have an odor. If gas does have an odor, the smell comes from bacteria in the large intestine. The bacteria release small amounts of gases that contain sulfur. Causes. Gas in the digestive tract comes from air that you swallow, the breakdown of food by bacteria in the large intestine. Everyone swallows a small amount of air when eating and drinking. The amount of air swallowed increases when people chew gum, drink carbonated or fizzy drinks, drink through a straw, eat or drink too fast, smoke, suck on hard candies, wear loose-fitting dentures. Some of the swallowed air leaves the stomach through the mouth when you burp. Some swallowed air is absorbed in the small intestine. The stomach and small intestine do not fully digest all of the food that is eaten. Undigested foods pass through to the large intestine. Bacteria in the large intestine break down undigested foods and release gas. This gas is passed through the anus. Small intestinal bacterial overgrowth, or SIBO, can also cause excess gas. SIBO is an increase in the number of bacteria or a change in the type of bacteria in the small intestine. It may also cause diarrhea and weight loss. SIBO is usually related to diseases or disorders that damage the digestive system or affect how it works. Some of these diseases include Crohn's disease or diabetes. Certain foods may cause gas. Foods that produce gas in one person may not cause gas in another. Vegetables that may cause gas are artichokes, beans, broccoli, cauliflower, mushrooms, onions. Some fruits may also cause gas. These include apples, peaches, pears. Other foods that can cause gas are milk and milk products such as yogurt and ice cream, sodas, fruit drinks, and other drinks that contain high fructose corn syrup, sugar-free candies and gums that contain sugar alcohols, whole grains such as whole wheat and bran. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Symptoms. Gas can cause many gastrointestinal symptoms. These include burping and flatulence. Burping occasionally is normal, especially during and after meals. If you burp often, it may be caused by eating certain foods or by swallowing too much air. Flatulence is also normal. If you begin to pass gas more often than you normally do, it may be a sign of a digestive problem. Bloating is also a sign of gas. It is often described as a full feeling in the abdomen. It can also cause the abdomen to swell. Gas moving through the intestines too slowly can cause bloating. This happens with certain digestive diseases such as IBS. Gas can cause abnormal pain or discomfort. This happens when the gas does not move through the intestines normally. Gas may also cause pain in other areas of the body, such as the chest. Not everyone experiences these symptoms of gas. If you have symptoms that get worse or worry you, talk to your healthcare provider. Talk to your healthcare provider if new symptoms happen, especially in people older than age 40. The gas is accompanied by other symptoms, such as constipation, diarrhea, or weight loss. Your gas symptoms are bothersome or change suddenly. Diagnosis. You can try to find out what is causing your gas symptoms on your own. This is done by keeping a food diary. Write down everything that you eat or drink throughout the day. Also write your gas symptoms in the food diary. The diary can help determine which foods are causing your symptoms. If you see a healthcare provider, he or she will ask about your diet and symptoms. Your healthcare provider may also ask to see your food diary. A physical exam will be performed. If your healthcare provider thinks milk products are causing your symptoms, you may be tested for lactose intolerance. Lactose intolerance means you have trouble digesting lactose, a sugar found in milk. Tests for lactose intolerance may include avoiding milk products to see if symptoms improve, blood tests, breath tests. You may also be tested for other digestive problems depending on your symptoms. Treatment. There are many steps you can take to reduce the amount of gas you have. You should avoid or limit foods that cause you to have gas symptoms. Avoid gum and hard candies. Avoid milk products if you have lactose intolerance. You can also reduce gas by drinking less fruit juice, especially apple or pear juice, drinking lots of water and avoiding fizzy or carbonated drinks, eating more slowly so you swallow less air when you eat, quitting smoking. You should also check with a dentist if you have dentures. Poorly fitting dentures can cause you to swallow extra air. You can also limit fat in your diet. Fat does not cause gas, but less fat in the diet helps the stomach empty faster, which allows gas to move more quickly through the intestines. Medicines can help reduce gas or the pain and bloating caused by gas. If your symptoms still bother you, see your healthcare provider. Some medicines to treat gas are available over the counter. These medicines can help the body digest beans and many vegetables, help the body digest lactose, relieve bloating and gas pains. Lactose-free products are also available at many stores. People with lactose intolerance can consume these products instead of taking medicines. Prescription medicines may also help treat gas caused by digestive problems. These medicines may be given to people with SIBO, IBS, and other digestive problems.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Everyone has gas. Most people pass gas 13 to 21 times a day. Gas in the digestive tract comes from two sources: air that you swallow and the breakdown of undigested food by bacteria in the large intestine. Certain foods can also cause gas. Symptoms of gas include abdominal pain or discomfort, belching or burping, especially during and after meals, bloating, passing gas. There are ways to reduce the amount of gas you have, such as avoiding certain foods and swallowing less air. Medicines can also help reduce pain and bloating caused by gas. Over-the-counter and prescription medicines are available. Thank you for using Explain.